Well, good afternoon, everyone. After 20 years of clinical practice, I've seen patients get stuck relative to their diabetes and metabolic syndrome, weight loss. And so today's discussion will include some unique aspects of how inflammation affects the brain, carbohydrate cravings, alters some of the inflammatory pathways relative to overall regulation. So we know that inflammation is a killer. It contributes to Alzheimer's disease. It contributes to cancer. It hastens the risk for heart attack and multiple other diseases. Inflammation and chronic infection, as you can see in red, is associated with all kinds of cancer. So 25% of cancers are related to chronic infections and unresolved inflammation per this 2012 peer review article, as you can see cited. By the way, all of these slides will be available. Just give me your email and I will give them all to you. So don't worry about copying anything. You just listen and I will send them all to you. So interesting, however, that chronic inflammation is a risk in and of itself. And I can tell you that I have patients with 16, I have people with 32 CRPs, I have people with 40 CRPs, and they had no idea why they were feeling sick and tired, except they're cooking from the inside. They thought they were having hot flashes, night sweats. Well, guess what? They're inflamed and they're cooking in their own juices. And strangely enough, we end up diagnosing with a multitude of other diseases. And of course, looking for the cause is paramount. So the prevalence of diabetes per 2009 showed a tremendous geographical uniqueness. So depending on what state you work in or which country you work in, it might determine how much more you're going to have to look at this risk factor. I have multiple people coming in for weight loss, and lo and behold, they have an HbA1c of a 6.6 or a 7.2. And as I point out, when you have insulin resistance, you basically have pre-hung carbohydrates waiting to get into those cells and get stored. So you can see from 1998 in the blue, and you can see the prevalence, and blue is about 15 to 19% prevalence of obesity. It's more than doubled over a decade. And the question is that literally because we're lazy, we don't exercise, we don't have willpower, or is it that where it's pro-inflammatory, we have other issues going on, there's something going on, and we're going to discuss that. So 79 million pre-diabetics, 18.8 diagnosed diabetics, and a lot of people waiting for us to diagnose them with diabetes. So I do HbA1cs all day long because we know the fasting glucose just isn't going to get the job done. Snapshot in time, or as I tell my patients, a Polaroid picture. So whatever outfit they have on, I say, so you wear purple every day, huh? No. I said, well, your blood sugar is not the same every day either, so let's look at that 3-month measurement. I also explain to our patients that, of course, we all know as clinicians that red blood cells live 120 days. So what are we measuring? We're measuring glycosylated hemoglobin. When I graduated, that's what it was called, glycosylated hemoglobin, not HbA1c. So we're looking at glycation of those red blood cells over those 120 days. And I said, imagine those cells that live longer than 120 days. What does that damage unto your body? I mentioned retinopathy, nephropathies, neuropathies, and I said, oh, that kind of makes sense. No one's ever explained it like that. So, of course, the effects of inflammation and what I will call the caramelization of our cells. We're made between 50 and 75 trillion cells, and when we have bathing under blood sugars, we have this phenomena. We have the caramelization of our cells, and if the cells are represented by our popcorn, guess what? We got caramel corn, and that's a lot tougher, more resistant, and as a result, not as functional. So glycation can be compared to caramelization, and everybody gets movie theater popcorn, kettle corn, and Cracker Jacks. And it says the higher your blood sugars, the more Cracker Jack you have, and less soft and fluffy and buttery your cells. And they're like, oh, that kind of makes sense. And of course, we know that we have the ability to go back and forth with the blood sugars. There's a great medical doctor in our area. His name is Dr. Miles Hassel. And him and I sat on an R25 NIH grant at Oregon Health Science University. And he is a medical doctor internist. And we were sitting on this board looking at the curriculum of the MD medical school because I was the dean at the time. And I said, so Miles, what supplements are you using? Oh, say, Chris, we don't use supplements. We do diet and lifestyle. This is a medical doctor preaching to the naturopath, right? He says, I have a 70% reversal of early on diabetes with just diet and lifestyle. And once again, we know that they got there a certain way, but what we're going to discuss today, the inflammation, the neurochemistry, and we all know about comfort food, and we're going to discuss that today too, relative to neurochemistry. So if you look at the little asterisks here, the big killers in America, of course, are heart disease as always, and there's a debate, is heart disease winning?